guys, and welcome back to this segment on our channel called Answering Your Most Googled Medical Questions by Gastro. And today's video is a super interesting one, so let's get started. So in today's video, we'll explore the question, what are 10 medical causes of rapid weight loss? So most of us will experience fluctuations in our weight, and it is common to lose or even gain weight over time. With all the stats you hear today about worldwide obesity, you might think of weight loss as an inherently good thing. But when weight loss is rapid and unintended, it can in fact signal a worrisome underlying medical condition. Rapid weight loss is generally defined as unintentional weight loss to be 5% or greater weight reduction over a 6 to 12 month period. While typical weight loss is due to a change in lifestyle habits such as decreased caloric intake or an increase in physical activity, unexpected and unintended weight loss can throw up some red flags. So here are 10 medical causes behind your rapid weight loss. Number 1 is thyroid disease. So hyperthyroidism, or an overactive thyroid, develops when your thyroid gland makes too much thyroid hormones. These hormones control many functions in the body, including your metabolism. If your thyroid gland is overactive, you'll quickly burn calories even if you have a relatively good appetite. And the result of this can in fact be unintentional weight loss. Number 2 is diabetes. So in people who suffer from type 1 diabetes, an insufficient amount of insulin prevents the body from getting glucose from the blood into the body's cells to use as energy. When this occurs, the body starts rapidly burning out the fat reserves as well as muscle for energy, thus causing a rapid reduction in the overall body weight of the patient. Number 3 is cancer. So according to the American Cancer Society, unexplained weight loss is often the first noticeable symptom of cancers of the esophagus, pancreas, stomach, and lung. When one has a growing cancerous tumor, pro-inflammatory cytokines are released into the bloodstream, which cause inflammation in the body. These cytokines not only disrupt the hormones that regulate our appetite, but they also promote the breakdown of fat and muscle in the body, which leads to rapid weight loss in these patients. And another reason why cancer patients experience extreme weight loss is because the growing tumor uses a significant amount of their body's energy, which goes on to increase their basal metabolic rate, meaning they burn through calories much faster. Number 4 is depression. So depression is a feeling of sadness that doesn't go away for 2 weeks or longer and begins to interfere with your ability to function on a day-to-day basis. One of the most common signs of depression is a change in how much you eat. A loss of appetite is a common side effect of clinical depression, and it is one that promotes unexplained weight loss very quickly, especially if you aren't aware that your mood swings are in fact something more serious. Number 5 is celiac disease. So celiac disease is a serious autoimmune disease that occurs in genetically predisposed individuals where the ingestion of gluten leads to damage in their small intestine. When patients with celiac disease eat gluten, which is a protein found in wheat, rye, and barley, their body mounts an immune response that attacks the small intestine. These repeated attacks then lead to damage on their intestinal villi, which are the small finger-like projections that line the small intestine and promote nutrient absorption. So when the villi get damaged, nutrients cannot be absorbed properly into the body, which then potentially leads to malnutrition in these patients as well as weight loss. Number 6 is inflammatory bowel disease. So inflammatory bowel disease refers to 2 inflammatory gastrointestinal conditions with immune system dysfunction, which are Crohn's disease and ulcerative colitis. Crohn's disease can cause inflammation in any part of the gastrointestinal tract from the mouth to the anus, and ulcerative colitis, on the other hand, only affects the large intestine. Inflammatory bowel disease can reduce the body's ability to digest food properly or even absorb nutrients, which can both lead to malnutrition and weight loss too. Number 7 is Addison's disease. So Addison's disease is most commonly due to a rare autoimmune disease that harms the adrenal glands and prevents them from producing enough cortisol and aldosterone. Cortisol helps the body respond to stress, including the stress of an illness, injury, or surgery. It also helps maintain blood pressure, heart function, the immune system, and blood glucose or sugar levels. And aldosterone affects the balance of sodium and potassium in the blood. This in turn controls the amount of fluid the kidneys remove as urine, which affects the blood volume and blood pressure too. Low levels of cortisol may decrease a person's appetite, cause them fatigue, and cause them vomiting and anorexia, which all lead to great weight loss. Number 8 is HIV. So HIV, or human immunodeficiency virus, is a virus that attacks cells that help the body fight infection, making a person more vulnerable to other infections and diseases. Weight loss in HIV-positive patients has many possible causes. These patients may lose weight fast because they have another infection, and these infections are called opportunistic infections along with the HIV. They can also suffer weight loss due to problems in absorbing nutrients from the food they eat, and these patients have mouth sores called thrush, which often makes it harder for them to eat. And they also often lose weight because the HIV medications they take make them suffer from a loss of appetite. Number 9 is chronic obstructive pulmonary disease, or commonly known as COPD. So COPD is a name for a group of lung conditions that cause breathing difficulties and includes chronic bronchitis and emphysema. When our lungs don't work as well as they should, our body has to work harder to breathe. This can cause us to burn up to 10 times more calories, leading to rapid weight loss. In addition to this, COPD and its symptoms of shortness of breath and chronic cough can also lead to patients having a decreased appetite, which also contributes to their weight loss too. And finally, number 10, which is tuberculosis. So TB is a disease caused by the Mycobacterium tuberculosis bacteria that are spread from person to person through the air. TB usually affects the lungs, but it can also affect other parts of the body, such as the brain, the kidneys, or even the spine. Weight loss among patients with TB can also be caused by several factors, including a reduced food intake due to a loss of appetite, the patients taking in less food due to their nausea or abdominal pain, and also weight loss due to the impairment of the immune system, which uses tons and tons of its energy to fight off the infection. And that brings us to the end of this video. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure you turn on your bell notification so you'll be notified every time we have a new upload. If you would like to help us make better videos and content, you can also donate to us via PayPal. Take care, and thanks for joining me today as I explored 10 medical causes of rapid weight loss.